Hey, we're on your side with health news. It is spring, and for a lot of you, that means it's time to get fit. People are more physically active after the winter. Our medical expert, Dr. Dave, joins us now to talk about preventing exercise injuries.
Hello.
Good afternoon, Mike and Jenny. Many of my patients are more physically active with the warmer weather, and for some, this is the start or the restart of exercising after a break. And exercising after a long break can lead to injuries, and folks want to know how to prevent these injuries.
Ease in.
That's right. That's the most important point, Mike. So the most common injuries are a pulled or a strained muscle, a sprained ankle, and knee and shoulder injuries. And so number two, you want to ask your doctor before starting an exercise program, especially if you're a man over the age of 45 or a woman over the age of 55 or have medical problems. Number three is to know the risk factors for injury. If you are a smoker, you've had a prior injury, or you have low aerobic fitness levels after being physically inactive for a while, then you're at risk for injury. Number four is to be realistic and set your exercise goals to match your fitness level, and take precautions if you've had a prior injury not to exercise over an injured area, especially if it hurts. And then finally, number five, remember these steps before, during, and after exercise. You want to warm up your muscles and joints and stretch before, and cool down and stretch afterwards, and have water and a light snack about 30 minutes before you exercise. As Mike said, when you're starting an exercise program, you want to ease your way into it and listen to your body.
Good advice, good advice. All right, listen, I don't want to cut you short on that topic, but we have to talk about the situation down in Kings County that's happening right now. The student at Lemoore High who's been diagnosed with tuberculosis. A lot of people freak out when they hear TB. Is there any reason for concern?
Well, TB is an infection that, like any other infection, exposure to does not necessarily lead to an active infection. And health officials are taking the correct steps for less close contacts. They're having folks undergo skin testing. And for closer contacts for family members, this student will be isolated, will need to wear a mask and cover up around closer contacts.
And you think it's likely that this student either traveled out of the country or was exposed to somebody who recently traveled out of the country?
That's right. Somebody who has active TB, either in this country or outside of this country, exposed this student to the TB.
All right. Dr. Dave, thank you so much.
You're welcome.
Dr. Dave joins us every Tuesday here on The Noon Show. If you have a question or a topic idea for her, just email it to us at newsdesk@cbs47.tv.